Hi, my name is Scott Toussaint. I work for Bioness, and I'm here to show you the Dynavision D2, which is distributed by Bioness. The Dynavision is a system that's geared to help rehabilitate folks that have visual perceptual issues, such as a hemianopsia, inattention, so it could be a hemianopsia, quadrantanopsia, maybe decreased peripheral vision from something like macular degeneration. The device is customizable, so you can use it with a wide variety of patients. You can bring the board up, you can bring the board down to someone that's very tall or someone that's in a wheelchair. It's very easy to use with all those different types of patients. There are lots of ways to customize the board. I'm going to show you a couple of modes right here, and we'll talk a little bit about customization, but really I'm just going to do a brush stroke on the technology. The best place to go to find out more information about the Dynavision D2 is to the Bioness website, which is www.bioness.com. So I'm just going to give you a quick tour of the light board, and I'm going to run what's called Mode A. It's going to run for a minute. The lights are going to light up one at a time. I'm going to turn it on right here. So let's just take the approach that we had a patient that had a visual field cut, a left visual field cut. Patient standing in front of the board. The lights are going to light up one at a time, and I'll fire a couple here for you. So as the patient is scanning the board and hitting the lights, as the therapist, I'm working on helping retrain that patient in terms of a scanning strategy to overcome their visual field deficit. So the lights are just going to jump from one part of the board to the next. You can customize it completely in terms of the way you want it to light. So if you just want one quadrant, two quadrants, the entire board, or concentric rings, so you can customize it to that level. There are also neat options in terms of working on things like divided attention in conjunction with what you're already doing with the device. So if you have someone that you want to challenge them a little bit more, so as they're scanning for the lights and hitting them, we can have a number flash up in this box right here. We can have the patient call that number out, subtract that number, and now it's adding another layer of challenge to what they're doing. Let me run one more mode here that'll have some different lights flashing. So I'm just going to select mode B. We're going to have green lights flashing as well. So it gives you a little countdown as it starts. So you can see that there's a nice melding for using this from a visual perceptual standpoint with patients. Looking at the entire system as a whole, you can use it for really anything else. So dynamic standing balance, if you wanted to work on that. If you want to work on crossing the midline with your patient, it's wonderful for that. Just active range of motion or active assisted range of motion. Have someone sitting or standing while you're facilitating the patient reach from one point to the next. And you can grade it up and grade it down very easily from that standpoint. The device is also going to take some patient outcome data for you, so it's going to track your performance. It's going to look at the specific quadrants, the amount of time it took you to get to those quadrants, and it's going to track that graphically for you, which is really nice from an outcome standpoint, from a documentation standpoint. So we're just going to run Genevieve through a 1-minute program here. I'm going to first adjust the height for her, so I'm just going to bring it down a little bit so this box is right at her eye level. Good, and Genevieve, go ahead and get to a comfortable distance so you can reach the top of the board or the bottom of the board. And if she was taller in a wheelchair, we just adjust the height accordingly. So I'm going to start up mode A. This is called the apparatus-paced mode. So basically Genevieve is going to have as much time as she needs to scan the board, find the light, and hit it. So it's going to stay lit for the entire minute if she needs it to get there. There are also other modes. There's mode B, which is a user-paced mode. So you can set it to basically change positions after a certain amount of time. So if Genevieve needs a little bit more of a challenge, we can have that light jump from one position to the next if she misses it within half a second or a second. So adding another layer of challenge there. Okay, so she's run through the program. It's pulled up all the outcome data, and we're done.